Welcome to the Deep Dive. Today we're embarking on an essential deep dive, understanding macular degeneration, MD, and a truly unique, comprehensive approach to its treatment and prevention that your sources highlight. Our mission, really, is to pull out the most important nuggets from the material you've shared, giving you a real shortcut to being well-informed about this, well, this pervasive eye condition.
Exactly. And our goal today is to equip you with the crucial information you really need to understand about MD. Stuff you should know even before you might chat with an expert. We're going to challenge some common assumptions and critically uncover some proactive strategies for looking after your eye health.
Okay, so what's the absolute first line of defense against MD according to these sources, and why is that initial step, that insight, so vital?
Well, the most important thing, as your sources really emphasize, is catching MD before any structural damage is even visible.
Before you can see it.
Precisely. There's a specific test for this called the ADT-DDEX test. It's not widely known, surprisingly, but it's quite sophisticated. It measures how quickly your eye's specialized cells, the rod cells, crucial for low light vision, and adapting after brightness, how quickly they reset after a bright flash.
Okay.
So a prolonged recovery time signals a subtle but significant impairment. It's often the earliest sign of MD risk, long before you'd see structural changes on a scan. Detecting it this early, before that irreversible damage kicks in, well, that's as close to a cure as you can possibly get.
Wow.
And if you have a family history of MD, this test is particularly relevant for you. Really something to consider.
Now, many people just sort of see macular degeneration as, an inevitable part of just getting older, but our deep dive suggests it's way more complex. What your sources reveal about the real underlying causes, well, it really challenges that thinking, doesn't it? What are these root causes?
Yeah, that perception of MD just being getting older, it often masks the complex and, importantly, treatable biological things going on underneath. Your sources pinpoint specific underlying causes, things like oxidative damage, chronic inflammation, problems with the body's DNA repair mechanisms, hormonal deficiencies, and, of course, broader dietary and lifestyle factors.
This is not just aging itself.
Exactly. While aging, plays a role, the core issue is that the cells are losing their ability to protect themselves. So this comprehensive approach we're discussing aims to kind of reactivate those cellular defenses so they can fight off oxidative stress, tamp down inflammation, and repair DNA damage more effectively.
Okay, so if those are the systemic root causes, how do we actually uncover them in a specific person? A key tool revealed here, maybe a surprising one, is comprehensive blood testing. Why is this so pivotal?
Blood testing is, well, it's absolutely crucial for revealing these underlying issues. Your sources highlight a group saying they're pretty much the only ones in the country integrating this kind of deep blood testing specifically for macular degeneration.
Really? The only ones?
Apparently so. According to the sources, their approach involves a personalized assessment right at the start, then again at 3 months, and then every 6 months after that. The goal is constant monitoring, identifying, and correcting any unmet needs or deficiencies. Basically optimizing everything so your cells, including those critical eye cells, can function at their absolute best.
That's fascinating that fixing things based on blood tests has these ripple effects on overall health. How does that wider systemic benefit feed back into better eye function, and what other benefits are seen?
It's actually pretty remarkable how targeting eye health this way cascades into whole body benefits. It makes sense, right? The eye isn't isolated. So when we optimize these underlying factors systemically, we see widespread improvement. Things like better kidney function markers, reduced joint pain because systemic inflammation goes down, better mood, improved sleep, healthier skin and hair, even better gut health.
Wow, quite a list.
It is. And yes, critically, those targeted cells in the eye, the retinal pigment epithelial cells or RPE cells, they also respond incredibly well because they're part of that larger system benefiting from these interventions we identify through the blood work.
Which brings up a really important question. If this approach seems so effective, based on your sources, why isn't it standard practice? Why have eye doctors largely, skipped comprehensive blood testing for a blinding disease for decades?
That's a significant point your sources raise. There's been this historical divergence. Traditional eye care focused locally on the eye itself, but these sources point out that for decades, comprehensive blood testing, which is standard for understanding many systemic diseases, has been largely absent from the standard ophthalmology playbook for MD.
Why?
Well, historically, the initial studies, maybe 25, 30 years back, were actually designed to disprove the value of vitamins for MD. They kind of accidentally proved some value, but then nothing. no follow-up to pursue more comprehensive strategies. So the current standard of care, often just simple vitamins, maybe eat more greens, became the norm, partly because, well, traditional ophthalmologists just aren't trained in areas like hormones or methylation or the nuances of nutraceuticals or even in-depth nutrition.
A training gap, basically.
A significant training gap, yes. And your sources argued this gap has unfortunately contributed to what they call an epidemic of vision loss.
Okay, moving from the causes to the impact, what kind of results is this functional medicine approach actually achieving for people with MD? What does the study show?
The studies highlighted show pretty significant impact, actually. For dry macular degeneration, the approach described could stabilize vision and, get this, even improve vision in about 48% of patients.
Nearly half seeing improvement, that's substantial.
It is. And for wet macular degeneration, they saw around a 60% improvement in managing the condition, which absolutely underlines the point. Early treatment is just so much better than late treatment. The longer people wait, the source is stress, the more irreversible that damage can become.
Now, your sources also mention a specific bad actor in wet MD VEGF. What exactly is VEGF, and how does this program interact with it?
Right, VEGF. That stands for vascular endothelial growth factor. It's basically the main stimulus for wet macular degeneration, the thing that causes the leaky blood vessels requiring eye injections to remove fluid and bleeding.
Okay, the injections target VEGF.
They do. But what's compelling here is that this functional medicine program, by addressing the underlying inflammation and oxidative stress, can actually reduce the amount of VEGF the eye produces. So if you have dry MD, less VEGF means a lower chance of converting to the wet form.
That's huge.
It is. And for people already dealing with wet MD, the program complements the injections. It helps lower VEGF even further. We've apparently seen retina specialists able to reduce how often they give injections, spacing them out more for patients on this program.
So if injections are the common treatment for wet MD, what are their downsides or limitations when used alone, according to these sources?
Well, injections certainly help people, no question. They stop the leakage and bleeding, which is critical, but they don't actually make the macula healthier. They aren't treating the root causes, that oxidative stress and the inflammation we talked about.
Right.
So the need for repeated injections happens precisely because you remove the VEGF, but the eye just keeps making more if the underlying problem isn't fixed. And it's important to remember, injections aren't trivial. They're, traumatic to the eye, can cause pressure spikes, and potentially lead to long-term complications. The goal, really, is to avoid overdoing it with injections, or ideally never need them in the first place by addressing the roots.
Okay, let's unpack this one more time because it seems so crucial. Time. Time is critical. What does this really mean for someone thinking about taking action on their macular health?
The message is just crystal clear. The longer you wait to get onto a program that actually targets the underlying causes, well, the more irreversible the damage tends to become. It's that simple. Earlier action is always the best strategy to avoid, all the horror of significant vision loss, how it impacts driving, hobbies, reading, just daily life. And what's also key and quite encouraging is that sticking with this kind of protocol often leads to better outcomes over time. We see continued improvement over months, even years. In fact, some long-term clients, people on the program for over 5 years, have apparently been told by their retina specialists, you know what, your eyes look beautiful and stable. I don't even need to see you anymore.
That's incredible.
It really is.
This reminds me of that powerful analogy your sources used, the house on fire.
That's right, the house on fire. Nobody, absolutely nobody, would wait until their house was a full-on inferno. If they saw a small fire starting, maybe just a bit of smoke, right?
Of course not. You put it out immediately.
Exactly, you'd put it out as quickly as possible. And it's the same principle with your eye. You simply don't want to wait until you have irreversible damage. The thought of losing sight is just, well, it's unconscionable. So the focus is always on preserving whatever existing vision you have, even if one eye is already badly affected. Because if the macula is truly burnt out and gone, like that house burnt to the ground, you can't rebuild it. The priority has to be preserving what's left.
Now, moving beyond just MD, our deep dive highlights links to other conditions. How does this kind of program interact with something common like cataract surgery?
Yes, that's a very important point raised in the sources. If you have underlying MD, traditional cataract surgery can, unfortunately, sometimes worsen your macular degeneration. Yes. However, the observation is that if a person is already on this comprehensive program beforehand, they're generally not seeing that negative outcome. People aren't losing vision after surgery in the same way. So the recommendation is clear. If you have both conditions, get treated for the MD before your cataract surgery. You don't want that nasty surprise of worsened vision post-op.
Good advice. What about diabetes? Is there a link there? And how does this program help diabetic patients?
Yes, definitely. Diabetes can certainly exacerbate macular degeneration. They often go hand in hand or make each other worse. The beauty of this program, though, is that it supports the diabetic patient holistically. It supports their macula, yes, but it also supports their entire body. Well, the blood testing looks at blood sugar parameters, metabolic function, all of that. And the program aims to make all cells healthier, not just the eye's RPE cells, but also, say, the beta cells in the pancreas for blood sugar regulation, or kidney cells. It leads to this whole body effect. You could call it anti-aging medicine, functional medicine, integrative medicine. It's basically helping the body fix itself by addressing reversible issues like hormonal decline, oxidation, inflammation, and nutrition across the board.
Okay. Now, red light therapy, that's a topic gaining traction in eye health. What's the take from your sources on this as maybe a complementary approach?
The sources indicate, an openness there in favor of anything that genuinely works. But when they look specifically at the data for red light therapy, while they note quite limited improvement in vision, just a tiny bit, really, it seems mostly geared towards stability.
Not major vision recovery.
Not according to this analysis. And one fundamental question raised is, people didn't get macular degeneration because their eyes haven't had enough red light for the last 25 years, right? It's not like a red light deficiency disease.
Fair point.
Plus, it can be very expensive. We're talking many thousands of dollars, apparently, for numerous office visits for what seems like a minimal return, maybe 4 or 5 letters on an eye chart. Not terribly impressive in the grand scheme of things. This program, in contrast, is designed to attack those root causes we discuss, the oxidative stress, mitochondrial issues, hormones, inflammation. So the suggestion from the sources is if you do pursue red light therapy, it probably should come on top of or after a comprehensive macular program addressing the underlying biology.
What about geographic atrophy, GA, and maybe some other less common retinal conditions?
Right, geographic atrophy, or GA, that's where the retina is. Atrophic, it's thinning, degenerating in specific patches. Now, there's a big push currently for eye injections to try and stop those atrophic areas from getting bigger. But this program, interestingly, seems to be helping stop geographic atrophy progression as well, potentially reducing the need for those injections.
So it might offer an alternative or complementary approach there too?
Potentially, yes. And the good thing with GA is it often progresses slowly, so it allows for careful monitoring. You might have a choice injections or exploring this program while your doctor keeps a close eye on things. And the benefits might even extend beyond MD and GA. The sources mention seeing people stabilize or improve with other macular diseases too, things like retinitis pigmentosa or other inherited conditions. So it's not strictly limited to just age-related macular degeneration.
So bringing this all together, what does this imply about the unique expertise and background behind this comprehensive approach we've been exploring?
Well, it really speaks to a unique combination of skill sets, background, expertise, and actual clinical experience. Your sources describe, on one hand, an ophthalmologist with decades of experience in functional medicine, and on the other, a PhD in biochemistry with a master's in nutrition who's really applied his, brain power specifically to the macula over the last 10 years or so.
An unusual combination.
Very unusual. Their journey was unique, too. They apparently started by treating the body systemically using functional medicine and then discovered, through observation and results, that it could profoundly help the eye. They essentially followed the biological trail, you could say, like a good hound dog, and that led them to develop this comprehensive macular program.
It certainly sounds very different from what you'd find in a typical eye clinic.
Oh, absolutely. It's described as truly unlike what you'd find basically anywhere else. And the reason is a conventionally trained eye professional often just isn't equipped to leverage all this systemic knowledge, all this complex testing into the clinic or to create such personalized plans.
Right, the training gap again.
Exactly. Traditional ophthalmology kind of, tiptoed into functional medicine years ago when they helped develop those simple vitamin formulas like AREs. But they were kind of out of their league, Their training just didn't cover the depth needed for hormones, methylation, oxidative stress, nutraceuticals, nutrition in this personalized way. So that mistake, just giving out simple vitamins and calling it a day, that unfortunately, as the sources argue, contributed to this epidemic of vision loss.
Whereas this approach
treats MD fundamentally as a cellular degenerative disease, one with multiple possible underlying causes that can be identified and addressed using a functional medicine strategy guided by detailed blood work. When you think about it, it's really common sense, isn't it? And the
Yeah.
results they report, patient charts showing stability, even improvement well, that's genuinely exciting.
It's clear how deeply you both believe in this based on the sources, and it seems it comes from personal experience too, is that right?
Absolutely. There's a profound personal connection mentioned. Both individuals involved have family histories of MD, one's mother, the other's father, but crucially, neither of them shows any signs of developing it themselves because they are actively following the program. They are, in a way, the living proof, the prototype for the prevention model.
Wow.
And the ophthalmologist's mother, she was actually their very first patient in this context. She was put on an early version of the anti-aging program, and her MD just stopped progressing. It remained stable for 15 years until she passed away at 90. That was apparently a huge eye-opener for them, real validation that the program worked.
What an incredible deep dive into macular degeneration.
Mhm.
We've really covered a lot from the vital importance of early detection, like with that ADPDX test, and the true underlying causes, moving way beyond just getting older.
Mhm.
Then there's the groundbreaking role of personalized blood testing, how this comprehensive program works to stabilize and even improve vision, the absolute critical role of time, and how it all interacts with things like cataract surgery, diabetes, maybe even red light therapy.
Yeah, and if there's one core take-home message from all this, it's this. If you have macular degeneration, you need to address it, fix it, treat it early. Seriously, treat it before you lose vision. If your doctor tells you you have drusen, those little yellow spots, or other changes in your macula, you really should do something about it right away because the current standard of care, just vitamins and leafy greens, it's simply not stopping the disease for most people.
So if this deep dive has resonated with you, if you're listening and thinking, what's my next step? The source material suggests reaching out, connecting for a personalized conversation about your own unique situation. They also make the point that early cases are often not only easier to treat, but maybe as a bonus, can end up being less expensive in the long run too.
Absolutely. We'd encourage you to take that step. We're confident this deep dive has armed you with some really valuable insights, and we look forward to speaking with you.